Today's webinar, A Bear of a Problem, Brain on Fire, with Dr. Jill Crista. This is Beth Hampton, and I'll be your moderator today. If you wish to print them out, a link for the slides for today was included in the final webinar reminder email that was sent to you this morning from WebEx. The webinar will be recorded, and links to both the recording and the slides from the presentation will be emailed to you within 48 hours. If you experience any audio or technical issues during the webinar, please refer to the instructions posted in the chat box. For those of you listening through your computer, if you experience audio issues, it's usually due to your internet connection. If you do lose audio through your computer, try calling in on your phone instead. There will be a short Q&A period at the end of the webinar. If you have any questions, you can post them in the Q&A box at the bottom right-hand portion of your screen, and then we'll ask those questions. I'd like to welcome today's presenter, Dr. Jill Crista. Dr. Crista earned her naturopathic doctorate degree with honors from the National University of Naturopathic Medicine in Portland, Oregon in 2003. For over a decade, she was the director and a participating member of 2 integrative clinics offering naturopathic medicine, integrative medicine, acupuncture, chiropractic, physical therapy, and massage. Here, she witnessed the efficiency and synergy of the team approach to patient care. She's now focusing on research, teaching, and writing. As an experienced PANDAS and PANS parent and treating physician, Dr. Crista recognizes, as much as she wishes it to be true, there is no magic pill to help these suffering kids. It takes a village and a village worth of tools. The struggle these kids face inspired her to understand the science behind their strange and particular symptoms and develop treatment approaches that work. Moved by the dire stories and pleas from fellow parents, she committed to sharing her unique insight, which builds in the trenches experience and research findings into the foundations of her naturopathic training and principles. We'd like to thank Dr. Crista for her time today and welcome her to the webinar.
Thank you. This is a real treat to be on this webinar. Thanks everybody for tuning in. I hope that you'll take home clinically useful information and not feel like you've just been drinking from a fire hose, because that could be kind of how this presentation will feel. So let's get started. What we're going to try to cover today, and some people had contacted me ahead of time saying they weren't really sure what the topic was, but that we're talking about autoimmune encephalopathies, and I'll define what that is. We'll cover the mechanisms of PANDAS and PANS specifically, of all the autoimmune encephalopathies. We're going to just hone in on those two, and then familiarize you with the symptom picture, outline my treatment approach, and then talk about plants that help and some that can actually hinder. So we don't want to be making the problem worse. Autoimmune encephalopathies, it's an umbrella term that I use, and those of us treating PANDAS and PANS, it's bigger than just PANDAS and PANS. We think of it as infection-induced autoimmune encephalopathy. So that can include autoimmune encephalopathy, but it can also include PANDAS, PANS, NMDA, receptor autoimmunity, and NADAL, which is a new one that is related to Lyme disease. The trigger is infection. So that can be, and actually now that I'm working in mold, I'm seeing that mold can actually be a trigger as well. So I think that we can think of infection-induced autoimmune encephalopathies. It kind of needs to be expanded to infection and toxicity-induced autoimmune encephalopathies. The target tissues depend on the specific type of AE that you're dealing with. PANDAS and PANS targets the brain stem, specifically the basal ganglia, the GI, and the kidneys, glomerulus. So the mechanism of PANDAS and PANS specifically, if we narrow that down, what the research tells us to date, although there isn't much, it is helping us sort of figure out what's going on in these conditions. Excuse me. There's a pre-existing immune deficiency state. That is a particularly naturopathic or functional medicine viewpoint. That's what I see in practice, is that kids were functioning along, especially if they had a very healthy family they belonged to and healthy lifestyle, and then something triggered it, and it just tipped that immune system over the edge. There's T-cell mediated damage to the brain triggered by that infection. There's microglial activation, damage to the dopamine receptors, and then responsiveness of the dopamine receptors. and then that alters the central dopamine pathways. You'll see an excitatory neurotransmitter state, so high glutamate, and chronic neuroinflammation. In the kidneys, you'll see chronic glomerulonephritis and what I call GI galtitis. So the lymphatic system of the GI or the galt is just overall inflamed. That trigger turns on, as in many autoimmune diseases, it turns on, and I say it lights a bunch of campfires, and we have to run around and put them out. But really, we all know it's really bad parenting. I put this one in here because so many PANDAS and PANS parents are blamed. The parents are blamed for the kids having these neuropsych symptoms that are related to a physical illness. And I continue to get that in your head. These are neuropsych symptoms related to a physical illness. This is not bad parenting, and this isn't a crazy kid. So we'll go into some of these more specifically. The pre-existing immune deficiency state, what's going on there is that there's an increased rate of IgA deficiency in peds who have OCD compared to children with ASD, anxiety, and adults with OCD. So in other words, and in my practice, I see this related to food sensitivities that go unaddressed. There's an association between antibiotic-treated infections and the subsequent risk of mental disorders in children and adolescents. This is based on a Denmark study where they track everything because they have socialized medicine, they have this blood bank, and they've been able to now do historical studies to look back in the people that end up with, in the children and adolescents that end up with mental disorders. Many of them had infections that were treated with antibiotics. And now it's not only a correlative study, they're starting to talk about causation. So what are we supposed to do in medicine when we have a kid who we really do think needs antimicrobials? I would love to see some study where they parse out the people that use natural antimicrobials and those that use drugs. So in the pre-existing immune deficiency state, we also see that there's a dendritic cell role, and I think that this has specificity to nasal infection, and that really informs our treatment. I call the nasal and sinus area the gates, and part of my core treatment of PANDAS and PANS is to guard the gates. The T-cell mediated damage to the brain is triggered by strep in PANDAS and PANS. PANS, of course, also can be triggered by other things like mycoplasma pneumonia, Lyme disease, Bartonella, babesiosis. These are things that can be pre-existing, but then the strep is actually the trigger, and it triggers a Th17 response in the sinuses that travels the olfactory bulb to the brain, crosses and damages the blood-brain barrier, and induces an autoimmune attack on the basal ganglia. And I put the plus there because we're now seeing it in the thalamus, and that there's also an additional possible Th1 role. So now we're adding things like herpes, EBV, and H. pylori. Herpes and EBV are tied to mold exposure. H. pylori is tied to Lyme because it's a spirochete family, or it's similar in nature. So those are some of the things that you can see as co-infections or comorbidities that can happen either pre or during a PANDAS and PANS flare. Microglial activation, basically this is the brain's macrophages. They're the resident immune system. So when I hear microglia, I think about macrophages, and it's just when something goes into the brain, we'd have to change the name of it, so we know it's brain specific. What we're seeing is defective microglia lead to the OCD behaviors. I have a little star there because this is a study done on mice, so that's why I have pathological grooming. That's what we call it in mice, but in kids you can see repetitive hand washing. Not always, and I really want people to reframe how they think about OCD, that it's compulsions, not necessarily certain behaviors that we have related to OCD in adults. But in kids, you can see pathological grooming, being very cautious about getting infections, not wanting to be around sick people because they know intuitively they're going to get sick. They tend to be really cautious about leftover food because they know that has a higher histamine and higher microbial load. So their bodies, the compulsions, tend to be things that if you really see through the weeds in them, it is the body being super wise and trying to avoid more triggers. So in mice, we saw not only pathological grooming, but hyperanxiety, and then social impairment deficits, so social isolation in mice. And you see that with kids as well. They get attached to parents, attached to home, and start to desocialize with siblings and with peers. So what is the role of the microglia? We don't really know. It's a newcomer on the field because we are better able to research it now. We do see that in studies, SSRIs reduce this effect, but it's a lab-induced condition. So basically, they flood the mouse brain with like amphetamines and things that cause anxiety behaviors that are similar to what we would call OCD behaviors in mice. So pathological grooming, hyperanxiety, social impairment deficits, that kind of thing. So they load them up with drugs, and then they give them SSRIs. So my question is, what about wild type? What about wild type OCD, and what about wild type autoimmune encephalopathies? Do SSRIs really help? And the reason that I start asking this question is I have many, many patients that want to consult with me who have failed SSRI treatment. It did exactly the opposite of what they thought it was going to do. So in my takeaway, it's still about immune system resilience. More details on the neurotransmitter dysregulation. We see the DOPA 1 and 2 receptors are attacked in the thalamus. They're the targets of attack, and so you see a dopamine excess. And I have a question here. I mean, there's a lot we don't know. So does this happen only during a flare? And then could they possibly go into dopamine deficiency when they're in remission? Some of these kids actually feel worse. They report feeling worse when we get the inflammation under control. And part of that, I think, is a relative dopamine deficiency and also adrenal fatigue. We also see glutamate excess, so that's just that trigger that happens when you get the Th17 traveling the olfactory bulb, crossing the blood-brain barrier, the inflammatory response is glutamate mediated. And then a cholinergic interneuron antibody binding. So what that means is basically ACH-type reactions, and that makes picking drugs really tricky. Chronic neuroinflammation, we see this with lots of conditions that have to do with itis of the brain. That distinguishes OCD from normal controls. I find this incredibly interesting. If you take somebody who's normal and or mice, and take a sample of their basal ganglia, the normal mice don't have inflammation, the ones with OCD do. So again, this is a neuropsych manifestations of a physical illness. This isn't crazy people. So, and what we see also is it extends beyond the basal ganglia. It's not only the thalamus, but they're seeing it in the cortico-striato-thalamocortical circuit. I cannot tell you exactly where that is in the brain, but I want you to think like it's bigger than the basal ganglia, especially the glutamate effect. The symptoms are a wax and wane pattern, just like any autoimmune disease, so it makes it very difficult as a practitioner to determine if when you're in a wax, are you having a flare? Are we not doing a good job on the inflammation, or has there been a new exposure? When there's a wane, we don't really know if that's just a typical pattern, it was going to reduce anyway, or if we're doing something effective with treatment. So it makes it very difficult, as with many autoimmune diseases, to treat and to know if you're doing anything that's really effective. Some variation in PANDAS versus PANS. PANDAS is technically a sudden onset. PANDAS can come on slower or more gradual onset. The age is typically younger with PANDAS than it is with PANS. PANS is kind of known as the teenager or early adult kind of autoimmune encephalopathy. And then the triggers are different, as we spoke about. With PANDAS, it's strictly strep. With PANS, it is other things pre-existing that then make you predisposed to strep. The diagnostic criteria for PANDAS is very strict. The ones that I have here are technically PANDAS, but you can see the same demonstration of symptoms in PANS. So there's the presence of OCD, and again, I want to really emphasize this is compulsions, not just what you would call an adult OCD. So it's a child who has to make sure they zip their zipper up before they put their left arm in their left sleeve, that kind of thing. So there's little compulsions, and I think if you see through it, a lot of it is a protected mechanism. So compulsions and/or tics, particularly multiple. So you might see complex tics where they're doing a circular pattern with the arms and then shake their head down, or an eye blink that happens 3 times plus some kind of jump, that kind of thing. So they can be complex. The age requirement is at least 3 years old, and then to puberty is PANDAS, and then PANS is typically puberty on, but again, I've had pre-pubertal kids that had PANS. Acute onset is definitely the PANDAS and episodic, and then like we talked about, the PANS can be gradual onset. Category 4 is that they've had a group A streptococcal infection associated with their condition. And the tricky thing here is that a lot of these kids are strep negative on culture, on a throat culture, and there's a portion of them that particularly have immune deficiency that are IgG immune deficiency, like a hypogammaglobulinemia or a CVIDS, that will actually be serum seronegative strep and strep design. So this one's a little, don't be too serious about the fact that we have to have a diagnosed strep. And again, PANS can have multiple infectious agents. Category 5 is associated with some neurological abnormalities, fill in the blank there, and then comorbidities that nobody really talks about, but that are really cause a lot of suffering in these kids. Urinary frequency, think about trying to go to school and you can't leave the class. Mydriasis, insomnia, generalized abdominal pain, which is found worse in boys than in girls, interestingly. Here's my treatment overview. I kind of think about these 6 things. Am I guarding the gates? Am I modulating the immune system? Addressing neurotransmitter imbalance, reducing neuroinflammation, sealing up the leaky blood-brain barrier, managing trauma and stress and the burnout on the body, and then managing structural integrity. There's so much swelling at the basal ganglia that they can actually displace cranial bones, and these kids then, the glymphatics or the lymphatics of the brain can't drain because of that structural integrity issue. So that gives you my overall kind of like what I'm looking for. I'm trying to halt the T-cell migration to the CNS. We're trying to prevent autoimmune tendencies, balancing those dopa and glutamate receptors and also the neurotransmitters. Those things can cause destruction, so then you're chasing that problem. Neuroinflammation, we want to get the good stuff in, the bad stuff out. Adrenals get a major hit with this condition because when they do have a flare, these kids feel unsafe constantly. It's the alarm is saying, I'm not safe, I'm not safe, I'm not safe, I'm under attack, because they really are, physically. And then, like we talked about, so cervical congestion you will see, and then some jaw development needs to be addressed, and I work with holistic dentists on that. So now we get into the fun stuff, botanicals. I was thinking, wouldn't it be great if there was a botanical avatar, like one plant that did all these things? Okay, I'm going to go back one slide. That's our overview. Wouldn't it be amazing that if we could have a plant that addresses those things? So a broad spectrum antimicrobial, sort of guard the gates of the body, the sinuses in the gut, the immune modulator, something that neutralizes neuroinflammation, a brain antioxidant specifically to the brain, something that reduces dopamine and glutamate and maybe boosts GABA and serotonin because those get depleted, trying to balance the flame and the excitatory state that these kids are constantly in. Their GABA and serotonin gets depleted. Something that might protect the kidneys because we know that's a problem, and heal the gut. Guess what? There are lots of them. And the connection is triterpene saponins. That's the tie that binds all these things. And the cool thing is they're lipophilic, so they get into the nervous system, they get intracellular to the mitochondria, they're immune modulators, they're steroidal in nature, which manages inflammation, they restore neurotransmitter imbalance, they're antioxidant, and they restore programmed pruning, which is a term for the brain trying to prune out neurotransmitters that aren't either, the term use it or lose it. When someone retires and they start kind of getting more debilitated, it's because they're not being challenged. So they need to be doing Sudoku. They need to be exercising because the brain is programmed to prune out things you're not using and put more highways and I call them neurohighways, to things you are using. So more diversity is a healthy brain, but if these kids are stuck in an inflammatory cycle and only the dopamine and the glutamate are being fed, then they can get program pruning to actually make them more susceptible to glutamate and dopamine excess further down. So the botanical avatar also corrects that problem. That's pretty cool. Now there are some botanical badatars. Some of them will actually worsen the neurotransmitter imbalance. and those tend to be the ones that are good for Parkinson's. The funny thing is, on my avatar list are good for Parkinson's also. So take time to research first and understand why or how that is helping Parkinson's. And be really cautious with autoimmune encephalopathy cases when you have a plant that you're adding that you think you know is really good for Parkinson's. Oh, it probably would be really good for this condition. Not necessarily. So those that will increase the expression or the upregulation of DOPA receptors versus those that heal DOPA receptors, those make my Batatar list. And I am all alone on this, but there are a couple of plants that during a flare, I avoid, and they're some of our favorites. That is turmeric, boswellia, and schizandra. Those are things I avoid in these kids when they're in a flare. Those are also things that are incredibly valuable once you get them controlled at restoring expression of dopamine, regulating those dopamine receptors as they heal. Those are all really important things once you have a healed kid, to get them out of the doldrums of, I'm not in a chronic excitatory state anymore. But during a flare, these are things that I avoid because I've seen them cause aggravation. So now for the avatars. First, though, we have to talk about how do you get herbs into kids. You can print this slide. This is kind of my thing. Ask the parents, obviously, but I have found that the tendency in trying to get herbs into kids is put sweet on everything, and that's a mistake because you can, most of these botanical avatars for infectious-induced autoimmune encephalopathies are bitter. So you're going to get more success using savory. You might do better with hot versus cold. A lot of these kids have texture issues because there's crossover with autism spectrum disorders. And check the time of day. I mean, there might be some kids that are way more willing to do stuff in the morning than at night, or vice versa. So ask the parents and then kind of work that out with them. Obviously, you can use teas, glycerids, powders, mix or cook it into food, make popsicles, and a lot of kids that I work with, the parents are making like little chews with glycerizer or with honey or with molasses. Mixers, again, honey, blackstrap molasses hides a ton of bitter. That's a really good ace in the hole if you have a kid who likes that. Coconut, butter, ketchup, mustard, spaghetti sauce, curry, salsa, teriyaki. Use your imagination. Don't always go for the sweet. The chasers that I have found most successful are pickle juice and chai. And if they're, dairy sensitive, well, soy chai is fine, or almond milk chai. My sneakiest tip of all, and I learned this from Mary Kay Cosmetics when I used to sell it when I was 19, homage to Mary Kay, is that you fry an onion for 5 minutes before giving anything that your family doesn't want to eat, because the aroma will boost systemic acid and prime the body for bitter. Then that positive association is set and subsequent dosing goes easier. That's kind of cool, isn't it? So expect that the child will refuse whatever method is working for you. So I counsel parents and families to set 2 or 3 things that work to get that particular herb into the kid. And for pediatric dosing, there's a great article by Dr. Tamara Cullen in the NDNR, September 5th, 2010. She has a whole article on dosing guidelines for the pediatric population. And I just pulled this table from that. That's the pediatric dosing guideline using Clark's rule, which is basically taking the child's weight divided by 150-pound, typically male, is what all of these are. These herb doses come from. All right. The first one, Berberis aquifolium, or Oregon grape. You probably guessed it already when I was talking about bitter. The triterpenoid saponins in this are stigmasterol glucosides, and I will not promise to say all these correctly. The nice thing about this is it's broad-spectrum antimicrobial, so it's guarding the gates. It's also immunomodulatory. It inhibits the release of glutamate in the nerve terminals, so that manages that glutamate piece. It also protects against glutamate-induced neural cell injury. Having high glutamate for a long time really wreaks havoc on the nerves. So it will actually cause more lipid peroxidation, DNA fragmentation, and reactive oxygen species in the nerves. So by using berberine, you're improving the glutathione content and you're reducing or actually negating all of those things that glutamate can do. Berberine is also an antagonist at both the dopamine 1 and 2 receptors. So there's that, give it a break for a little while it's under attack. It's anti-inflammatory, antihistaminic. A ton of these kids also have histamine issues. It's promoted, berberine also promotes the gut microbiota to produce butyrate, and we know what that does, especially for a destroyed gut. It will help. It's the preferred food of those, the intestinal lining, and helps with energy metabolism. Butyrate also does some neurochemical changes, but I'm trying to just simplify so you guys know what your tools are. Berberine balances unstable blood sugar, and you can get berberine and those the triterpenoid saponins that are found in Oregon grape. You can also get from barberry and golden seal. Really cool. And again, I'm going to go back one slide here. I use savory. If you have a kid who can't do pills, I will use savory things with tincture, and it goes quite well. Gotucola, or Centella asiatica. This one kind of was a sleeper for me. I had no idea how strong of an antibacterial it was. There's a ton of triterpenoid saponins in this plant. It's not only antibacterial, it's antiviral and antifungal. So great for that PANDAS kid who has a lot of different infection triggers and needs a more broad spectrum support. It's neuroprotective. It will cross the blood-brain barrier in 5 to 15 minutes. That's really neat. So if you have a kid who does a known exposure, let's say a carpool or a sibling comes home sick, Gotucola tea immediately. It also preserves glutathione in the brain, protects against that glutamate and dopamine neurotoxicity of having excess. It will reduce LPS, induced expression and secretion of inflammatory cytokines. So again, this one is my, you've had an exposure, go take the Gotucola. Go drink the tea, or whatever it is that you, powder it and put it in honey, however, but it's the immediate exposure reaction so that you've put out as many campfires as you can so that you're not then chasing all those inflammatory cytokines over weeks later. Reduces oxidative stress. This is comparable in the brain to vitamin C and grapeseed extract reactions. And then it improves locomotor dysfunction. So you have a kid who tics is the main thing that they deal with. This is a great plant. Scutellaria bicolensis is one of my favorite PANDAS and PANS plants. I love the name of this saponin is Wagonacide. I hope I'm saying it. It just kind of reminds me of, Black Panther, like Wakanda forever. Flavonoid rich, super flavonoid rich. It's an antioxidant. And it regulates that TH1, TH2 balance. So if you have a PANDAS PANS kid who is also allergic to the world, this is a great plant. It's antibacterial, antiviral. It's neuroprotective, so it inhibits that LPS-stimulated damage specifically at that microglia, which we're able to see now that we can test microglia more readily. If the microglia stimulation is significant, it reduces the secretion and mRNA expression of inflammatory cytokines. So again, it shuts that down so you're not chasing campfires of cytokine storm for weeks after an exposure. It prevents any dopamine neurotoxicity at the within the nerve and at the bouton. And then it's anxiolytic and nephroprotective. So again, there's that extra added benefit that it's doing for the kidneys that nobody's really paying attention to. The kidneys get trashed with PANDAS and PANS. Albizia. I have a very funny story about this. I was tasting all of these plants as I get to know them and I learn about them. And albizia, I just took powdered albizia and I put it on my tongue, and I went into like la la land. I was so sleepy and calm, and the world was beautiful. And it was exactly what I would picture someone who's going through the terror, the inner terror of their brain being attacked, and attachment issues and tics and just, anxiety. It's just such a nice chill out. So when it says mood stabilizer on the slide, like, I mean it. It is a major GABA hit and serotonin hit. So it's nootropic, which that term just basically means it helps restore and rebuild brain and brain tissue, helps with memory retention. A lot of these kids don't remember a whole section of their grade they were in when they were in a flare. So they fall behind in school perpetually because they don't have retention of the information that they just learned, and that's particularly true for English and math. Those tend to be things where there's sequential learning. It's not just learn for the test. You have to actually carry that knowledge forward, and they have a hard time with that. Albizia is a strong antioxidant. It's an immune modulator, plus it has antibacterial, antifungal, antiparasitic. So it's just a lovely plant for the botanical avatar for pandas and pans. The mood stabilization, it also decreases DOPA. It doesn't just upregulate that serotonin and GABA like I was telling you about, put you in the buzz, but it reduces dopamine. It's a sedative, so you can use it before bed. Don't use this one in the morning. So when you're putting it in your plan for your families that you're treating, only put this one at night. Do not give it to them and then send them to school. Not fair. It's an anticonvulsant, so if you have a kid who has crossover of Tourette's, tics, epilepsy, and PANDAS PANS, this is a nice one to use. And it's pro-apoptotic, so there's that pruning again. It helps the body prune in things not related to PANDAS and PANS. We see that it helps pruning for gliomas. And so there's that question again, what kind of microglia control are we inducing by using these magical plants? You can boost the effect by also dosing it with NAGs. All right. Bacopa, or Brahmi. This one has pretty well-known triterpene saponins, bacosides and brahminosides. It's known as sort of like the brain preserver in Ayurvedic medicine, and it's exactly what it does for kids with PANDAS and PANS. It inhibits inflammatory pathways in the brain, and I think that in some ways this is why it's so brain preserving for people that have blood sugar dysregulation. And, you know, if you think about aging population, they're probably carrying a lot of inflammation. So by managing the inflammation, you preserve the brain. So it will inhibit the release of inflammatory cytokines from microglia cells, there's that key again, and the enzymes associated with inflammation in the brain. So it just shuts the enzymes down, denatures them. It increases cerebral blood flow, which is really important for, again, a PANDAS PANS kid who was doing okay. They then went to soccer, hit the ball with their head, and then suddenly developed a strep infection. And that triggered the whole thing. And then you wonder, well, what was it, the TBI or was it the strep? So this is great for kids who are able to be active in sports. They're not so impaired from their disorder that they can be involved. But if they're in the thing about excess dopamine is it causes extremist behavior. So a lot of these kids, they will not be interested in movement unless it has to do with risk. So Bacopa helps to kind of chill that piece out and heal up anything that might be trauma related as well. It reduces neuropathic pain. These kids have a very much heightened sense of pain. They're like the opposite of what you would give a homeopathic opiate for. I mean, they're just any little thing, and it's huge. And it's not because they're crazy or, you know, mentally disabled. It's because they really feel that. It's a central neuropathic pain. So Bacopa helps to calm that down. It's a neurotransmitter modulation of that cholinergic receptor status and then serotonin and dopamine. So the dosing is a little bit specific with this. With Bacopa, I tend to use 100 milligrams in the morning and then 100 milligrams like lunchtime or pre-lunch. If you get too high a dose, you can see that the acetylcholine kind of favors excitatory neurotransmitters. So you don't want to go, more is not better with Bacopa. That's the big takeaway. It does preserve the D1 and D2 receptors for dopamine and is especially hypoglycemic, especially if the person is hypoglycemic. This happens a lot with PANDAS and PANS because they tend to have food issues. That was one of the things I forgot to put on the slide. I'm just realizing there's a high correlation between PANDAS and PANS and anorexia. And it's because of fear of choking. It's not so much a body issue. It's that they fear the infection in the food and they fear choking on the food. I think that has to do with the swelling at the brainstem. I think they have a real hard time swallowing. Okay, astragalus. So the triterpenoid saponin with this is astragalosides, and we love astragalus, right? Think of it for immune, for antiviral, for adrenals, and that's all the right reasons that we would use it for PANDAS and PANS. The cool thing is it attenuates the progression of autoimmune encephalomyelitis via modulating that T cell differentiation in the CNS. So what I'm talking about is that Th1, there's a role, we think, of Th1 in the brain and then the Th17 trigger. So those are both out of balance, and the T cells will differentiate when it gets into the brain depending on what the milieu is that they walk into. So if you are using astragalus, it will help that T cell differentiation into a more healthy, not pro-inflammatory, but managed inflammatory or inflammatory modulation situation. Astragalus also reduces blood-brain barrier leakage, which happens with a strep exposure, reduces ROS production by upregulation of basically SOD to make more glutathione in the brain, and inhibits inflammatory cytokines. It's neurotrophic, so it helps not only differentiation of the immune system in the brain, but also the neurostem cells. So that will help restore all those dopaminergic neurons that have been attacked without being dopamine stimulating. All right, moving on to magnolia. Magnolia is, if you're in Chinese medicine, you probably know it very well. It's a great antimicrobial, but it also is a neuroprotective. It crosses the blood-brain barrier easily and has a really wide range of activity. So it's a nice one to start when you're like, I'm not really sure what the trigger is with this kid. I'm not even sure if they're a PANDAS or a PANS. It's all very confusing. And that's a great one because of the wide range of activity. It reduces neuroinflammation and is particularly protective of the NMDA receptor. So if you know you do have an NMDA receptor patient, magnolia is your plant. It's neurotropic, so again, it's building back the nervous system of the brain. It inhibits dopamine biosynthesis. It's an antidepressant, anti-anxiolytic, antithrombotic. So be cautious with kids who have low platelets. We see this in mold illness. Mold can lower the platelets, and so well, actually can increase them too. It just depends on what level of exposure you're at. And then same thing with Lyme disease. So if you have someone with Lyme disease and mold and PANDAS or PANS, just be watching the bloods on this, the blood markers, to make sure you're not causing any kind of problem. Honestly, I have not seen any problem with this. If anything, these kids are extremely thrombotic. They deal with claudication on a regular basis. You know, you look at the moon on their fingernails, and it's almost always purple. So I haven't seen much problem with this, but I just wanted to put that in there for safety. And it's an antispasmodic, so again, good for someone who's really struggling with tics. I've seen kids where the tics are so bad and they're centered on the diaphragm that they will tic until they pass out. So we need to have some of these plants on board to help them be able to breathe and manage. Okay, Panax ginseng. The ginsenosides are known as just beautiful for the brain. They're immune modulating, they're neuroprotective, they attenuate that dopamine-induced apoptosis, suppress intracellular oxidative stress. So that's another one. That's why it's used for, you know, the fountain of youth kind of thing, because it manages all that build-up as we age. And these kids are just having all of that same stuff happen, but they're young. It stabilizes excitable cells and regulates the voltage-gated ion channels. So again, if you have a kid who anorexia is part of their picture and they're starting to get destabilized to the point where their ions are off even on the blood test, like on a chem panel, this is a nice one to have. I use it in powdered form. With anorexia, they're very worried about, you know, consistency and sometimes about weight gain. So, but usually consistency. So I'll mix this one into MCTs, and it goes down really well and can start to stabilize some of that that electrolyte imbalance. Of course, we have tons of other things we can do to stabilize electrolyte imbalance. These are electrolytes happening in the brain. So those MCTs bring it, and just think anything with this, you're trying to put fat with it to try to get it into the brain. Most of these saponins are, well, all of them are lipophilic, so mixing them in something fatty helps really with the delivery. There is mixed data on the dopamine effects with ginseng, so that's another one I approach cautiously I'm using it for all the good things that it does, but I approach it cautiously, and if I see that it may actually be flaring the situation, we just pull it out, because there are enough other ones to use. Morinda is noni. This has another biphasic effect on the dopamine. So at a low daily dose, it will manage dopamine excess. But if you go too high, it's an agonist. But it is really good for the kids who are antipsychotic, who are having psychoses, like full on, needing to be hospitalized. My baby brother is trying to eat me. I want to kill my dog or my mom. I mean, some kids are really, really, really brain affected. So I've worked with kids who are hospitalized, just having a few sips of noni juice every day to try to get some stabilization of that dopamine excess and to benefit from the antipsychotic effect. Kind of scary what these kids have to go through at such a young age. So again, guard the gates. So using throat sprays for me is a major important thing to do, throat and nasal, for kids who are dealing with any kind of infection-induced autoimmune encephalopathy. I like there's our sprays out there with berberines right in them, so you can get them even closer to the brain tissue. You can also use xylitol. There was a meta-analysis of its anti-strep mutans effect and not only in the sinuses but in the gut microbiota. So if you have a stool test of a kid who you're seeing strep on that stool test, this could be something you could use in a throat spray and as a supplement, and you can manage that strep invasion or imbalance. And then nasal, I use colloidal silver and then essential oils. If they're sensitive to essential oils, you can use incense as well. But definitely guard the gates. Keep the gates solid so you don't have to be trapping trap the thief on the inside, and then also chasing down campfires in the body. So here's a little case I'm going to try and cruise through. I want to leave enough time for questions. But this is Will. He was a 7-year-old boy. He came to me with food sensitivities, ADHD, tic disorder, night terrors, insomnia, super sweet disposition, a very strong sense of right and wrong. He got the flu, and he turned into what his parents called a tyrant. He had a new onset of a vocal tic, especially when he was distracted, and that's when they brought him in to see me. He would scream out in pain from seemingly mild injuries, anger outbursts severe at injustices. Like he didn't like the injustice, but then he would physically attack his siblings and his parents. It was starting to strain their marriage, and because one parent had to stay awake all night to protect the siblings and the pets because they were afraid that he was going to kill them. He was no longer able to attend school, but he described the fact that he was lonely for friend love. So he realized that this wasn't right and referred by the school nurse for Ritalin. His plan involved a Bacopa Magnolia combination. This has a woody bitter flavor with hints of like bitter chocolate aftertaste, so we mixed it into dark chocolate with MCTs. He ate that with breakfast. That was given early in the day because Bacopa tends to have an uplifting and energizing effect. He had Scutellaria bicolensis that he would have a teaspoon before lunch and dinner. For this, he liked the glycerin, and if we added it to various savory sauces, he really liked teriyaki. So we got it in with teriyaki. It can upset an empty stomach, so that's what we would do at meals. And then he would take Albizia before bed, and they said, he's sleeping. We can't believe it. We would do it with bone broth to get those nags in there and really maximize the effect. And he would just have his little broth before bed or before a parent was leaving, because he was also very, very, very attached to the parents. We also guarded the gates with an Oregon Grape Golden Seal Throat Spray. That's one of my favorites. We would do that in the morning and night. The xylitol spray morning and night to protect from strep, because he lived with siblings who would go to school and bring stuff home. And then if he had any kind of close contact with a friend, if he actually got friend time, then he would do the throat spray of colloidal silver as well. For him, we avoided eggs. There is some great research out there showing that eggs can cross-react with brain tissue in PANDAS and PANS cases. Not an allergy, but a similar protein structure that can trigger the same types of inflammatory responses. So we just took it out, focused on good fats and veggies, and he loves to help, and he loves to use the knives. There's that dopamine excess extremist behavior kind of thing. The sharper the better, and the bigger the better. He benefited from sweeping because there are research studies out there about using back and forth and sweeping and repetitive behaviors to manage tics. That also helped really calm down his rage events. He loved routine, and then everybody, we did breath work because everybody had bated breath waiting for the impending next bombshell. Overall, with his treatment plan, he was overall calmer, slept better, reduced his tic severity and frequency, reduced his pain sensitivity, used his breathing plan he would go to for anxiousness and anger because he started to realize that made a big difference. His family is mellowing out, and we do forget that there's a wax and wane pattern. So then when things start to wax again, everybody freaks out. You know, what's the infection? Oh my God, someone came home sick. But we're wondering if maybe his pet is the source of that exposure because he is still struggling and there's still that sort of wax and wane pattern. But that gives you an idea of a treatment approach. Here's Zoe. She's a 14-year-old girl with POTS and possible Ehlers-Danlos and restless leg syndrome. She went to a Lyme endemic area. Wisconsin, where I live, is really high in Lyme, and then also had mold exposure at her summer camp. Came home from summer camp with anorexia, severe, had to be hospitalized at 13 years of age. She complained of chronic stomach aches, urinary frequency, so then, you know, there was concern about, you know, was she abused at summer camp or was she bullied? But these are things that you can commonly see with PANDAS and PANS because of the generalized abdominal pain, the gultitis again. She started with chronic hand washing, germophobia. She won't breathe in crowds. She actually passes out if she's made to be around too many people. She'll just stop breathing. She's very socially isolated, as you can imagine. You know, weird girl. And she just says, "I'm not in the world. It's scary. I was just born broken, I guess." So when she was hospitalized, they put her on multiple psych meds, and she was super zombified in her visit. It was kind of like, hello, is Zoe actually in there? So here's her treatment plan. We started her on Go-To Cola for all kinds of reasons. And it has such a light, pleasant flavor with that little warming. She also complained of just being cold all the time, as you can imagine, with no body weight. We steeped it and made tea, and she drank 2 cups twice a day, added honey to taste. You can add honey to taste. She passed on the honey, of course, because it was weight gain and also that it might have infection from the bees. So berberis we also added. It was best for her as a capsule. If it's not an option, you can give as a glycerate, but for her it was easier for her to just take as a capsule. She was an older kid, so it makes it a little easier. We would do it with a bite or two of food, just, you know, whether she was going to eat that day or not, she had to have that one with food. And she was okay with that as long as it was, you know, because it was part of her medicine. So I asked the parents, what's the most medicinal thing that she thinks you make her eat? And let's have her take that every time. And for her, it was broccoli. Astragalus is so palatable and sweet. She was able to take glycerate and really enjoyed that. Teaspoon 3 times a day. Her diet, we collaborated with an anorexia counselor. For her, it was less a body image issue and more about a choking and food reaction. Food made her feel worse, so we did some testing on her genetics, and it turns out she had DAO SNP and had histamine sensitivity. So no more leftovers for her, because those are high in histamine. And we focused on, you know, good fats and then pre-digested or macerated proteins. So I hate to say it, but hot dogs were easier than, or, you know, burgers were easier than having her do a piece of chicken. Veggie smoothies worked really well for her as well. So we guarded the gates with colloidal silver and nasal and throat spray, diffused some essential oils, and she loved burning incense. She felt like that was her, she would do a little like prayer that the incense cloud would cover her, that she was the reverse, oh gosh, what's the guy in Snoopy's? The reverse guy that, you know, he always had the dust cloud around him, and so he just looked like Pigpen. She was the reverse Pigpen. Thank you for whoever intuited that to my brain just now. And she carried a scarf snuff of thyme and eucalyptus when she was in public, and then she would go ahead and breathe while she was in public. In some of her successes, she improved her dietary intake overall. Her mood lifted, but started as swings. So that was a little disruptive to her family, but I said that's normal. It's just getting more vitality, and so that can look more disruptive. But eventually it turned into a steady lifting. Started to join her parents in her garden, got her hands in the dirt, and obsessive hand washing when she would come in. Oops. She developed a fever, rash, joint pain, and probably from being in the garden and getting bit by either a spider or a tick. And so we added some Lyme co-infection and Bartonella antimicrobials, specifically Hutinia. And she was, by adding that, it was interesting, she was very slowly able to wean off the psych meds. So we wonder if she didn't have a pre-existing Lyme disease. And she's starting to make social connections and started a blog about her experience. Okay, so that wraps up my portion. Just want to make sure that you guys definitely know your herbs. There's the in-clinic and direct ship dispensing is so handy for you, especially if you are like me and doing more consulting. It's just so nice to have that available. I love Gaia in their transparency. You know where the plants are coming from, and that's one of the reasons why I rely on them very heavily for my prescribing. And then clean ingredients. Again, you know that what's in the bottle is what's supposed to be in the bottle, and things that aren't supposed to be in there are not in there. All right, so I'm going to, I guess, turn it over to questions because I'm sure there are many. But here are some botanical medicine resources if you want to get more information. Some of these plants I learned about through Stephen Buhner's books as well. They weren't part of my normal, probably not things I learned in school. They're things I learned about after, some of them. And then lots and lots of resources on my website and also the PANDAS Physician Network for you guys. Dr. Angela Knapp, one of our own, has some great Facebook Live interviews that are fantastically informative. Andrea Nakayama has an interview with me on a 15-minute matrix, and there you can download my matrix of the whole picture, naturopathic medicine, functional medicine, picture of how to manage a PANDAS kid. And then on my website I have PANDAS shorts. They're 5-minute or less short videos that are topic-focused and solution-focused. They're $2. And all proceeds are donated to the Institute for Natural Medicine to fund research and to the PANDAS Physician Network, or to the PANDAS Network to fund research on pandas and PANS. That's it. Thank you very much.
Thank you. We do have some questions. So the first one is, we were hoping you could just remind us what the Batatars were. There's 3 herbs.
Yep, you bet. And again, they're Batatars only during a flare. I want to make that really clear. Because they are beautiful plants for restoration afterwards. But they're turmeric, boswellia, and schizandra. Perfect.
Can you explain the link between leftovers and histamine sensitivity?
Yes. The longer a food sits after it's been cooked, the more histamine is built up in that food. So there are some great resources online about histamine diets, and Dr. Ben Lynch, his book called Dirty Genes is where I learned most about this, and he has a list of high histamine foods. Leftovers are on there. Bone broth is on there also, so if you, it's kind of a bummer. So if you have a kid who has definite histamine issues and PANDAS and PANS, you can use just regular broth, but not bone broth.
Okay. If anybody else wants to submit a question right now, that was the last one that I had.
Oh, okay.
I think that you shared a wealth of information with us. I, for one, am blown away at your knowledge base. It's amazing.
Well, it's one of my, as a parent, you know, that's one of the things you do is you go on these deep dives. So, yeah, that's part of, you guys are getting my first round of trying to codify all of the stuff swimming around in my head. So I'm sorry if it was a little much.
And I'm sorry, this is Valerie. A couple of questions came into me. I just want to address them since we have the time. Someone asked how you can find a practitioner that could work with her child, kind of like you're doing.
Yeah, the PANDAS Physician Network is a good place to start. And I think, again, Dr. Angela Knapp, I think she has a really good handle on who's out there doing this. She's really taken this on as a topic that she's learning a lot about and trying to disseminate a lot of information and get people in contact with each other. So she might be somebody that would know people more in the naturopathic sphere. The PANDAS Physicians Network does have naturopathic doctors, functional medicine doctors, psychologists, dentists. It's a network of all kinds of people that come in contact with these kids. So we have to handle it from all of those different directions.
Thank you. Another question, which botanicals did you use for the tick-borne infection?
Houttynia, Houttynia, and I may be saying that completely wrong, but that's one that's particularly good for Bartonella. And for this girl, Zoe, she had all Bartonella symptoms, which is kind of tricky because Bartonella can cause neurological problems in ticks, ticks from the ticks, and so can pandas and pans. So you're not necessarily always knowing which one you're treating, but with these plants, it kind of doesn't matter at that point. If they're getting better, the plants aren't harmful. It's not like you're using a medication or an immune suppressive drug.
Excellent. Someone's asking if you have a quick recipe for little kids and maybe using fats and sweets to help them to take their herbs.
I don't really. We play, again, with that idea that expect that whatever is working is not going to work even 2 days from then or even 2 hours from the last time the kid took it. These kids are very changeable and volatile, so we have done everything you can possibly imagine, from olive oil to balsamic vinegar infused with, we have a really cool vinegar shop in town. So they have like apricot balsamic vinegar, and we've been able to mix that with some olive oil and put some of the plants in there. So I would say just go to your recipe book and look at things where there are sauces of different ethnic disciplines and histories and start playing.
Good advice. I'm going to keep going since we have probably about 3 more minutes. Can you talk about the prevalence of these encephalopathies and their prognosis?
Oh boy, I don't think that the prevalence is very well represented in research. I think that there are a lot of these kids that are subacute or chronic and have figured out a way to manage it, or the parents have taken them out of school, so they're off the radar. Parents get blamed a lot for these conditions. I remember one time sitting in I took my kids to a theater show, and they had vocal tics at the time, and the more exciting the show was, the louder the tics were, and we got shushed out of the theater. And I thought, you know what? We don't have control over this, So I noticed another parent who had autism had a little business card that he would hand, and it said, "My kid has autism, please excuse any outbursts." And I thought, I'm going to make myself business cards like that, because if they understand this is a physical illness, they wouldn't shush a cancer patient, but they're shushing these kids. So just to let you know, then parents kind of go deep, they go under, and they just stop going for care because they're not finding any help. So I think incidence is severely underrepresented. And then prognosis is mixed. I think if we can make sure that we're able to preserve neural function and not overdrug them, and not overdrug them and ignore the real problem, which is neurological destruction of receptors in the brain, then the prognosis is great. If you have a kid who is pretty healthy going into PANDAS tends to be the one where it's a healthy kid, they got whammed, and then they get treated and they're better. PANDAS, in that kind of situation, the prognosis is fantastic because it was a single event. If you're dealing with more of a PANS picture where there's been low-grade chronic immune deficiency and then there's just that final infection or that final trigger that tipped the scale, that's a little harder, and you're probably talking management at least through puberty. Some say that this all goes away after puberty, but I have not actually seen that to be the case in practice. I think then it's just the person who's affected figures out how to fake it enough to look normal for society. It's for society's sake, not necessarily for the person. So the prognosis for me is for a PANS situation, this is something that they will have to manage for a long time, maybe their whole life. We just don't have data. But they'll, through management, you know, healthy lifestyle, the appropriate diet, some herbs on board to help them, and infection management, they can live super healthy lives with no sequela. But they do need management. I hope that was helpful.
We have a question. You mentioned throat sprays.
Yeah.
Do you mix that yourself, or is there, you know, one that you purchased?
Can I say whose I use? I use Gaia's. Yeah. Is that all right to say? But yeah, that's because it's already mixed and it's easy. And patient, you know, the parents dealing with these kids, they need easy. They are in total crisis all the time. So for my practice, I use as much pre-done as I can so that we can use creativity for how to get the medicine into the kid.
That's great. You talked about eggs and avoiding them because they're strep carriers, and then saying that the protein may cross-react to their own tissues. Could you comment on that?
Yeah, I can point you to research by Jill Crista ND. He is the one who has really been championing these food reactivity cross-reactions. I learned that at a conference, and he was presenting his data, and I just thought, oh my goodness, this would be the easiest thing to take out if it makes a big difference. So I would encourage you to go find his, check out his research. It's on PubMed, and his first name is Datis, D-A-T-I-S, and I'm going to probably misspell his last name, so if somebody in the chat wants that knows how to spell it, but it's K-H, I believe, A-R, that would get you started, A-Z-I-A-N. I think there might be 2 R's. And apologies, Dr. Kazarian, if I'm saying your name wrong and spelling it wrong.
No worries. All right. That's awesome. Thank you so much.
Yeah. And then if anyone has follow-up questions, my email is on, I think, on the slides. Or you can just email me through the website, drcrista.com, and I can try to help with anything that didn't make sense in my talk, because we went through a lot of information.
Awesome. Thank you, Dr. Crista, for a wonderful presentation. And thanks everybody for joining us today. As a reminder, you will receive an email within 48 hours with a link to the recording of the webinar and the slides that were presented. And we hope to see you all in a future webinar.